Good morning, everyone, and thank you for participating today's webinar. The topic is using the Deutsche Telekom cloud as a selling point and why this can be a door opener. Alexander will go into more detail later, but in Germany it is hard to get acceptance for data storage in the cloud, especially when it comes to patient records. So if it can't be avoided, it's important to make sure that the data is stored in a trusted location. In Germany, Deutsche Telekom is a brand that stands for all these things. And as I said, Alexander will go into more detail about this whole topic and about the solution Deutsche Telekom provides. If you have questions, please enter them into the chat box and we will read them out after Alexander's presentation and he'll answer it. And if you have any questions afterwards, please send an email directly to Alexander or to me. So may I welcome Alexander. Many thanks for your time today. Now I hand over to you.
Yes, thank you very much, Nicole, also for the invitation. Thanks for having me. Hi, everyone. As Nicole said, my name is Alexander Gerlach. I'm with the Deutsche Telekom Healthcare Solutions. I'm in the industry now for a couple of years, basically coming from a more technical background as a software developer and solution architect. Hence, I have more or less two roles in the company. On the one hand, I'm still one of the experts for medical software and architecture. And on the other hand, I'm also responsible for business development. And hence, my pleasure now giving you the talk here. Let's have a quick look at the agenda that I have prepared. I'll briefly introduce to you Telekom Healthcare Solutions. As Nicole stated, we see us as a digitization enabler for the German healthcare market and are very well known and recognized brands in the German healthcare system. Then I'll briefly give you an introduction into the German healthcare system with all its difficulties and challenges, but also the opportunities that we see now this evolving over the last 2 years, more or less. Also a brief look at the pay streams and actually what is the market we're talking about. It has certain rules. The German healthcare market is certainly a very attractive and interesting market, but you need to know a couple of rules to play the game here. And then I'll introduce to you our offering, the Open Telecom Cloud, which is basically a cloud made in Germany with our services that we have, also the certifications and what you can do with it. And at the end, I will wrap it up very briefly. All right, let's dive in. So the Deutsche Telekom Healthcare Solutions. As I said, we see us as a digitalization enabler for the German healthcare market. We are essentially a subsidiary within the DT group, Deutsche Telekom group, where we focus all the healthcare expertise of that group. We are about 200 people in Germany and roughly 300 in India, where we have our delivery centers. Essentially, as I said, we enable digital health based on our industry knowledge and the specific customer needs. That means we, as Healthcare Solutions, we are in the market for over 40 years now, with a couple of solutions which are built on the 4 building blocks you see on that slide here, which is digitization, connectivity, cloud and infrastructure, and also security, which is a very crucial point, not only in Germany, but especially since Germans healthcare professionals, also German citizens, are very aware and reluctant about their data privacy. And What we offer are a number of solutions throughout that healthcare system, starting with the hospital and rehab information systems, where we have our own solutions, but also partnering with SAP, for example. Also internationally, we have more than 300 international customers, about 200 in Germany. We have a telemedicine platform and an ecosystem that we're building up, especially since COVID. We see a huge growth in here. Unfortunately, it has to come to COVID to start the acceptance in the healthcare market for telemedicine. I'll talk about that briefly later. Of course, the healthcare cloud, which is one of the main topics that I'm responsible for, and also one of the big agenda points later on. We also have a study management platform for clinical trials, for example, for university hospitals working with pharmaceutical companies. And also we have a bunch of services for the health insurances in Germany. So this makes up also our customer base, which are hospitals and rehabilitation centers. We have all the major insurance providers as our customers in Germany. And also, since we are a provider of the telematic infrastructure in Germany, which is more or less a data stream, we have over 20,000 or 25,000 doctors connected to the platform through us, so to say. Yeah, that's only one slide about the telecom healthcare solutions, what we offer, what we can do, and let's dive into the second agenda point, where I will briefly explain to you how the German healthcare system works and what it's made up, and yeah, all its challenges and especially opportunities now, since you're interested in the opportunity side, I guess. So the German healthcare system, I would say, welcome to Germany. German bureaucracy at its best, especially for the healthcare system, which is kind of a market in itself, where it's built up on a self-governance structure, very complex, with very complex pay streams and also regulatory streams, where we have a bunch of associations, agencies that, well, negotiate how medical treatment is being done in Germany, and also how the pay streams are going, who is get paid by whom, is paid what. And this is a fairly complex system, and I won't go into details here. It's just for you as a teaser, more or less. But what's basically important for you to know is that we have a certain amount of players, so to say, in the German healthcare system, which is made up of the patients that are in the statutory health insurance, here GKV in Germany, that are about 90% of all the people in Germany that are in that statutory health insurance, which is essentially driving the well, the market in terms of money, but also in terms of the agencies and associations that are building up the self-governance structure. So we have about 113 statutory health insurances. We have a bunch of, well, doctors, general practitioners, but also a lot of hospitals, and essentially that's yeah, that is the main point of the healthcare system, right? So I'll give you a brief overview and a simplified view on that, because I think it's important to know how the system works in Germany. Although it's a very huge market, very interesting market for sure. We have about 365 billion euros of market volume. that is essentially driven by the patients or the citizens, more or less, that contribute to the statutory health insurances. And patients, payers, and providers is basically what is driving the market. Historically, it's a very closed system, hence this self-regulatory structure that essentially makes sure that we have a very high standard for medical treatment. But the funny part is that patients essentially pay the health insurance, but they don't pay or practically never see any bills from the healthcare providers, namely doctors or hospitals or anything. So they contribute their data more or less to the provider so that they can be treated accordingly. And all the billing data is then shared with the health insurances, but not with the patients. And essentially, that means in Germany, there's practically no self-paying market, so to say. So as you can see on the right, we have about 90% of the citizens that are statutory insured, meaning all these people, they practically have no idea what treatment costs, and also will never see any billing data and how the doctors are actually compensated for their for the medical treatment, right? And on the right hand side, I've briefly put some figures for you to get an idea of what we're talking about in terms of figures in the market. We have about 1,900 hospitals, making up about 500,000 beds, and also round about 100,000 general practitioners, doctors, officers. As I said, 90% of all the German citizens are actually statutory insured, and we have about 20 million inpatient cases per year, and also 77.4 million outpatient cases per year, because there's a big difference in Germany in terms of stationary hospital treatment and ambulatory or outpatient treatments in the physicians, which is also now kind of changing, but I'll come to that later. So even though we in Germany have a very high standard when it comes to medical treatment, in my opinion and in my view, we have a very low standard when it then comes to digitalization, unfortunately. Which brings me to my next slide, and I'd like to talk about Germany as a digital health emerging country. There was a study in 2019, the Digital Health Index, maybe you heard of it, but 17 countries have been compared. I think all of them were European, but they also included Canada and Australia. And Germany ranked 16 out of 17 countries. I think the last one is only Poland. And unfortunately, this shows how bad the digitalization is in Germany when it comes to the healthcare market. Other industries are, well, they play in a different league, unfortunately. And you have a couple of examples and that you see daily where doctors actually share treatments and diagnostic data with their colleagues via WhatsApp, for example, where on the same page we have doctors saying, I can't use the cloud, I'm not allowed, what is cloud, I don't want to store the data in the cloud, but then they talk about diagnostic findings and stuff with colleagues via WhatsApp or stuff. Now, why are they doing it? Because they're used to it in their private life, and this is something that just works and is available, right? And they have it at their fingertips. There's no bureaucracy around it, and there's also not much of regulations or observations going on, right? On the other hand, you still have fax in Germany, which is still the main driver. If you want to exchange documents, it's either via post office or you have to fax it. And as you may know, fax is explicitly unencrypted. So this is also totally against our current technology standard. But still, doctors, they get a certain flat fee for each fax they send. They don't get a flat fee for email traffics, for example, even though it might be encrypted. We are now working on it, and there's a new service there called KIM. But this is still the majority how data is shared in the German healthcare system, unfortunately. We still waste a lot of time for constant backphoning in the medical and nursing area, where instead of, well, completing tasks and kind of do your patient work that you actually like, and that's why you become a nurse, you still use around 50% of your clinical activity only for documentation purposes and typing letters and stuff. And this is there's a lot of room for improvement here. Also, if you look at the patients, for each doctor visit, you essentially need to report your anamnesis again and again, and you kind of get tired reporting all the same stuff over and over again if you have, well, I don't know, chronic diseases where you not only visit your same doctors because then they have your data, but if you need to visit different doctors for certain treatments, then you have to report that again and again, and you can avoid it. We have technology right now that that you can avoid it, and also a lot of time you actually wait at the doctor's office, even though you have an appointment. Usually you still have to wait. It's kind of never the case that the doctor is on point. For example, the pediatrician of my son is still using a paper calendar where they input all the dates, all the appointments of all the kids, and if something takes longer, then there's no effective way to kind of notify the patients or something that's, well, your appointment might basically shift half an hour or something, right? So then you sit there and wait, and this is basically time consuming and, yeah, not nice. So that's more or less the bad side of the German healthcare system when it comes to digitization. But over the last couple of years, we actually saw a certain momentum that is building up, and we saw that a mind shift is taking place, meaning the German Ministry of Health made digitization the #1 priority. They opened up a new dedicated department only for digitalization, and also, which is very interesting and was very new in Germany, the founding of the Health Innovation Hub, which is acting as an, so to say, external incubator to drive the implementation of the digitization. So not only driving the legislation, but also the implementation, and that is very important. This is something that we as industry have been struggling over decades when it comes to our solution being implemented, especially for new ideas. And this is a very new and, in my opinion, very crucial step. Also in 2018, we saw a lifted ban on telemedicine. Before that, it was actually prohibited for doctors to treat you via telecounseling. You couldn't even ask for a sick leave or something if you, if you have the flu or something. You needed to come in to the office, wait there with other flu patients, probably infecting a bunch of them, and before it was, yeah, before 2018, it was a no-go that you could ask for a sick leave certificate or something via telephone or video chat. Also, cloud computing was lifted or semi-lifted. I'll come to that later in 2018. And more importantly, there's also a payment scheme was discussed at that time for that, because that's important. Doctors now also can get a flat fee, which is essentially an incentive for them to offer that type of service. Also in 2019, 2020, we saw the Digital Health Act and last year the Hospital Future Act, which is driving, in my opinion, very important building blocks, namely the fast track for digital health applications. Also here, including a payment scheme for the industry, for you, and also for the hospitals. There's very big funding of about 4 billion euros that is only for digitalizing the hospital IT infrastructure, and also a very big part in IT security. So this is a couple of years that are now in place, driving the digitalization further. And this is why I say the momentum is actually now. We have a lot of tools now and a lot of opportunities available. And also what we see is that healthcare professionals and patients actually ask for digital solutions. COVID actually drove that very, very, very fast because there was simply no other alternative. But even before COVID, we saw that our basically, so to say, industry push effect, where we as an industry try to sell or push our solutions into the market, is now turning into a patient or healthcare professionals driven pull effect, where they expect us to have their solutions and they ask for it. So in total, I like to use the phrase that more has been moved and achieved in the last 15 months than has been in the last 15 years. And I think to some extent that's not an exaggeration. And as I said, we have a couple of gears in place now driving the future digitalization. And momentum is now, and this is a fairly interesting time to access the German healthcare market. Let's have a brief look about the drivers from our view that where we think are a bunch of key drivers for the different parts of the healthcare system, mainly patient insurances, the service providers, but also pharma industry, the medtech industry, and also for you, the startups. At the bottom, we have the telematic infrastructure, which essentially is the basis for data exchange in the future in the German healthcare market. So I very much hope then that in a bunch of years, or let's say sooner than later, faxes will be gone. And also telemedicine, as I said, is very much now almost a standard in times of COVID. We are working as an application on the telematic infrastructure. Finally, we have the first version of the electronic patient record. If you look at our European neighbors, that's almost embarrassing. They have that for years now. In Germany, we have it now, but essentially the usage is very low, which has a couple of reasons, but I won't go into too many details here. The electronic medical case record is in place for decades, I would say, but only for service provider, and we are seeing still more or less a silo structure. meaning that doctors in the outpatient world have their own medical case records, hospitals have their own medical case records. There's no sharing going on here, or if you want to share data, then it's being done over letters from one doctor to another doctor. And essentially your files are stored on paper in the basement of your service providers. So case management and essentially integrated care contracts are playing a more important role now, because the mindset shift is taking place, I think, where it's becoming more and more important to interchange data across all the sectors of the healthcare system. And as I said, healthcare professionals are asking themselves, like, why are we still doing that, and can't we do that on a digital way and a more secure way? So we see an ecosystem approach where healthcare professionals think more collaboratively, and also the patients themselves, they are now well more aware and want to be aware of their data and their health, basically, of course, driven by the digitization in the private life, right? You have apps, you have fitness trackers, etc. There's way more awareness right now than it was a couple of decades ago, in terms of patient, in terms of patients that they want to know about their health status, right, and want to be involved. And yeah, I think the Digital Health Act and the Future Hospital Act plays a major role from a legislative perspective, opening up a bunch of opportunities now also for digital apps, where digital apps are reimbursed. And this is basically the way to go. We have the DiGA, you might know that, which is the digital health applications. And coming this year, we will also have the DPass, which is essentially the same, but only for the nursing and rehab stuff, which is essentially a different branch in the healthcare system with its own rules and solutions, and therefore you will have there a different approach. But essentially it's about bringing digital apps into the market for the patients, and also making sure that the digital apps are actually giving you medical benefits, right? That is the core of the whole DiGA approach. You need to show that with your digital application, you're actually showing a medical treatment, right? Well, with that, I would say let's dive into the next part, which is the Open Telecom Cloud. One of our offerings, and one of the offerings that I am personally responsible for driving that as a business development manager. The Open Telecom Cloud, as I stated in the beginning, is essentially our cloud made in Germany. We have a German twin-core state-of-the-art data center placed in Magdeburg and Biere, which are high security locations, state-of-the-art mainframe data centers. We have separate rules. We are SOX compliant, and we also fulfill BaFin requirements for the fail-safe data center approach. And BaFin is the financial agency. They actually have way more restrictive rules than the healthcare industry, and we comply with that. Also, we as a telecom have a certain responsibility in terms of sustainability, and we operate all our data centers with 100% renewable energy. Also, starting last year, or more or less starting this year in terms of a beta test, we opened up a new location, also a twin core location in Amsterdam in the Netherlands. We're beginning in the middle of this year. It probably will start opening up for the regular customers as well, where you essentially can decide where data is to be placed. But what is in common that the data never leaves either Germany or Amsterdam, and also never leaves Europe in terms of the support and the operations team. So data storage is Germany or Netherlands, but we also have subcontractors, and a lot of our operations teams are sitting in Hungary, for example. So we comply fully with GDPR, and this is also very important when it comes to healthcare, because well, even though in some locations in Germany you need to know we have 16 federal states, and within those 16 federal states you actually have state laws citing what you can do with cloud and what you cannot do with cloud, and it's yeah, it's still a puzzle. And there's no overall rule. So even though in some legislations you are allowed to use cloud, you are also allowed to use European clouds, but in some location you are not even allowed to use a German cloud location, but need to host your data essentially in your basement at your location in the doctor's office or something. So that's something that we as Telekom are actively working on. And hopefully we will have basically German-wide agreement on how cloud is to be treated for patient data and also for social data in terms of health insurance data. Nevertheless, the Open Telecom Cloud has all the important certifications that you might expect from a full-grown cloud provider. I won't go into details here. One of the important ones is the Trusted Cloud Data Protection Profile, which ensures that we are fully GDPR compliant. And we have also a bunch of certificates from the BSI, or Federal Ministry for Information Security. Also, starting from this year, we are also compliant to the German Criminal Code, paragraph 203, which handles private secrets. And in Germany, if you are a physician or a lawyer, for example, you are privately you're bound to that you are not allowed to leak or talk about your client's private secrets, right? And if you do that, you can be penalized and up to prison time. And we as a provider, we made sure that all our subcontracts are legally bound by it. So this is one of our USPs actually for the German market, and also for doctors that want to use our clouds, right? They are in some cases legally bound and cannot use it simply. So also, well, if you look at our service map, infrastructure as a service, this is basically infrastructure as a service 101. We have all of them, right? Elastic Cloud servers. You might see a lot of parallels here to, for example, AWS or so. But also with our data center, you can also grab a bare metal server or a dedicated host, meaning you are not on shared resources, but actually have your own rack with all your own CPUs and hardwares and stuff. So even though we are a public cloud provider, inside the public cloud, you can actually buy your own private dedicated rack that is only being used by you. Of course, we have a Kubernetes engine, we have a bunch of storage options, a bunch of network options that are available, starting from VPN, load balancers. Also, we have the first hospitals that are actually have a direct MPLS link into our data center. we are working on a hybrid solution, very much similar to AWS Outpost, especially for hospitals. That's interesting. Of course, we have database services, management services, application services. Security, you get free anti-DDoS, for example, and in the artificial intelligence platform as a service side, we started the new offering this year. It's called Model Arts, which is more or less a collection and a framework built around well-known machine learning tools that you can use to build your applications. In addition to that, we as the healthcare solutions also provide additional services around security, operations, and interoperability, especially for the healthcare market, for example, with penetration tests, or also the support for DGAS, where you have a bunch of annexes in the legislation that you need to comply with. We can help you here. We are also working on application management and DevOps as a service for you to basically run your applications healthcare compliant, so to say. We have a bunch of FHIR experts that can help you to work on your interoperability and also the upcoming evolvements around the telematic infrastructure 2.0. Which means you as a DIGA, for example, need to be able to have access, or need to be able to write patient data into the electronic patient record. And how you can do that, we have experts here, and we are building basically an API for that. Also, we have a healthcare community on the Open Telekom Cloud. We have a bunch of German providers, German DIGAs that are already using our cloud. We all more or less have the same technical and regulatory challenges, and it's good to have a community where you can openly discuss that when you are on the same platform, so to say. Of course, I'll have a bunch of words about the pricing model, right? We have basically open elastic price model and a reserve price model, meaning on the one hand, you can only pay for the resources that you actually use, charged by the hour, meaning you have completely dynamic costs. You can try things out, but also we give you a certain amount of, well, not a certain amount, but rather a big amount of discount if you decide to go for long-term contracts. Yeah, I won't go into that into more details here. You can check out the webpage and also just talk to me, which brings me to my last point, namely the wrap up. I have a bunch of take-home messages prepared for you, since it was a rather diverse talk, so to say. Right, take-home messages. So I would say momentum is now. Keep that in mind. I think in Germany, the legislation made a very good job to actually drive digitalization and also build up a number of opportunities for new players to access the markets. And yeah, momentum is now. I think it's a good time. We as a telecom, as I said, we are a well-trusted provider. We are recognized for data privacy and data security. So as Nicole stated in the beginning, Germans are very reluctant and kind of very skeptical about cloud in the first place, but even more skeptical about overseas cloud providers, even though those overseas cloud providers have their dedicated data centers in Europe, and they have a bunch of technicalities in place to make sure the data will never leave their data center. But there's still a bunch of legislations in place, especially when it comes to state laws in the different federal states in Germany that are just prohibiting them to use them. So with us in the backpack, so to say, or hosting with us, you have a way better opening statement in the healthcare market. And with our Open Telecom Cloud as the platform, we see us as the alternative to actually the public clouds of overseas, and are fully compliant to all relevant regulations and can help you to, well, tackle the German market. And with that, I would like to thank you for your attention. And I can only say, let's have a chat. If you have any questions, you feel free to reach out to me. And yeah, thank you for your attention. Thank you, Nicole, for having me.
Yeah, many thanks, Alexander. Time again. And to the audience, do you have any questions? I can't see any questions in the chat at the moment. Please feel free to type in anything you want to know, or send an email afterwards. I would have a question. So, Alexander, you are close to hospitals with your hospital information system. Do you know any pain points the hospitals have in terms of digitalization apps? Are they looking for something special? Are there niches our Irish companies could go into? Do you have any insights here?
Yeah, I think what is currently driving the hospitals providers' minds is everything that is stated in the Hospital Future Act, namely all the digitization approaches that are being funded by the federal ministry. And there are a bunch of them where one of the most important one is patient portals, and the basically intersectoral collaboration between hospitals and also the outpatient and treated doctors, right? So I think patient portals is one of the hot topics currently, which is also something that startups are very well placed to offer that, right? And this is one of the major opportunities here.
Okay, that's very interesting. And you, as one of the hospital information system providers, is this a space you look for solutions, or are there other solutions you would like to take into your portfolio?
Yeah, we're constantly looking for partnerships here, and also our credo is not to develop everything ourselves from scratch and reinvent the wheel, so to say, but we already partner with companies, especially for patient portals. We're always open for new partnerships. Everyone brings their own nuances with it. It's not only patient portals, but also like voicification platforms, IT security stuff. This is something that is very asked for, I would say. Yeah, and okay. So we're always on the lookout for new partnerships. We can't say like flatly that this and this and this is that's what we need, but we decide on a case-by-case basis.
Okay, so now we do have a question, Glenn. Am I right?
Okay.
Yes, Nicole, that's right. We have one question here. Do you know, is the German market looking for a single solution that tries to do it all, or a best of breed approach?
Actually, if you would ask me 10 years ago, I would say they're looking for a monolithic solution. As I said, the minds are shifting, and especially we, as Deutsche Telekom, are going and advocating a best of breed approach here, and this is also where the market is going, and also where the providers and the providers in terms of service providers are going. They are rather going for the best of breed approach, meaning they select the best provider, or they want to have basically a framework that allows them to give their best medical treatment to the patient, but also comply with what the patient is expecting from a modern medical world, so to say, right? So yeah, definitely best of breed approach nowadays.
And do you think it's when you're coming from Ireland, you might be not very well known? Do you think that's a problem? And would you have any suggestions to overcome this?
Yeah, I think, well, first of all, you need to make sure your solutions are also translated. In terms of not very well known, it might be a problem to actually get market access in the first place. I think when it comes to partnership, this is something where we can certainly help you, because we have that access. As I said, we have hospitals, the health insurance services, and also doctors as our customers. Again, it's not a promise, but a case-by-case basis, right? If you go that route to say you are an official partner of Deutsche Telekom, that certainly helps. But in other cases, I think the Health Innovation Hub is also collaborating, especially with European countries, to bring that solutions into the German market, and also the new DiGA opportunity made it very interesting for startups, not only in Germany, to access this market. So you're not alone. There are a bunch of different small unknown players coming on the market, and this is a good thing, I think.
Okay, brilliant. Thanks, Alexander. Another question is, and this is specifically for digital healthcare products, are there procurement frameworks that suppliers can apply to be listed on and purchased from?
Not to my knowledge. There's not like a catalog or something that you can be listed on and then are basically bought. But when it comes to DiGAs, you have the DiGA catalog, where you as a DiGA provider and going through the regulatory process of becoming a DiGA, you will be listed on a DiGA catalog, so Digital Health App catalog, where doctors' offices can actually access it and then see to which medical condition, basically an ICD code, is applicable for that special digital apps. But it doesn't mean that this is a safe way to being prescribed in the first place, because doctors actually, they need to know that, they need to kind of learn it themselves, right? Currently, I think there are 11 listed DiGAs, and there are a bunch of DiGAs currently in the process.
Great. And another question we just have here now is, it's regarding, there was a case recently in in Finland, where there was a data leak of sensitive information from a psychologist group. Do Deutsche Telekom have measures in place to avoid a similar situation happening?
That's a very good question. Certainly, it always comes to the application level at some point in terms of your security measures that you have in place and also encryption measures. We as Deutsche Telekom, we are operating Europe's largest cyber defense center, and all the information that we are gathering there we are making it available as a service for all our partners and customers as well. So you can basically purchase the services of Europe's biggest cyber defense center to make sure that on the one hand, your network traffic is being monitored, but on the other hand, we have a huge number of experts in terms of security and privacy, and also offer pen tests, etc. Beforehand. So if you work with us, we can make sure to start closing the loopholes from the beginning in terms of application architecture and security around that. So we're trying to prevent everything possible, but of course, I think there's not 100% guarantee that a data leak will never happen, right? Data leaks, I think, also happen day to day in the analog world, but nobody's talking about it. For example, if a nurse just leaves a bunch of fax papers on the counter desk and patients are crossing that, reading patient names, conditions and stuff. And yeah, of course, in the digital world, this stuff is being way more critical because you can share that with a lot more than just a bunch of patients in your doctor's office. But yeah.
Okay, great. I don't see any more questions at present, and just like to ask the audience any last questions. We do have another minute here, but otherwise, if you have a more intensive questioning needed, you can of course reach out to ourselves or Alexander afterwards as well.
Yep.
Okay, so because there's no more questions coming on, I would like to thank you again, Alexander, for your time today and your very informative webinar. And as Glenn already said, to the audience, please reach out if you have any more questions.
Yeah, thank you also again for the invitation. It was my pleasure.
Okay, so many thanks again and have a nice day, everyone.
Bye-bye.
Thank you, everyone.
Bye.
Bye-bye.